Can you breastfeed when you have cold or flu? Can you take medications for cold or flu when you are breastfeeding? Hi, I'm Prachi. I'm lactation consultant from online lactation clinic Prachi Lactation. In today's video, we are going to discuss about breastfeeding when the mother has cold or flu. You can normally breastfeed the baby when you have cold or flu because the time from when you were infected and the time until you got symptoms, baby was with you and breastfeeding normally. So there is a possibility that you've already spread the infection to the baby. So if you continue to breastfeed, the immunity that is produced by your own body will help the baby to recover faster via breast milk. The breast milk supply will normally dip when the mother is having a lot of cold, cough, fever or body pain, and this dip will be very temporary, and once the mother recovers the supply will start coming back. So when you see this kind of a dip, you might need additional supplementation from the stash that you already have of express milk or formula. But there is nothing to worry because once the mother starts feeling better, the breast milk production will resume. Breastfeeding can be done normally as you are doing, or sometimes if breastfeeding is difficult but pumping is easier for your particular situation, then you can opt for pumping and giving express milk to the baby. Now sometimes it's difficult to do both. So if you have too much fever and if you miss out on breastfeeding or pumping, it's okay, but as soon as you start feeling a little better, try to resume as much as you can in terms of either breastfeeding or pumping. 1. To recover the supply as soon as possible, it's important that mother takes enough fluids, takes good rest and medications if required to get better, because the faster she gets better, easier it is to recover the supply. Certain precautions while pumping or breastfeeding can be helpful. Always wash your hands before breastfeeding or using the breast pump. Secondly, wear a mask if you have a lot of cough while you are pumping or breastfeeding. Thirdly, if you are using a pump, sterilize the pump parts before and after each use. You can take medications for cold or flu during breastfeeding, as most medications used to cure cold or even antibiotics or antivirals are safe during breastfeeding. It's important that whenever you visit your doctor, you do inform that you are breastfeeding, and your doctor can give you medicines which are safe during breastfeeding. But there is no reason to continue suffering with cold or flu just so that you don't have to take medications. There are two problems with this. First is that the mother takes longer to recover, and of course that's really stressful for a mother when she is managing a baby, but also the dip in the supply that we see extends for a longer period of time because the mother has not recovered faster. So this was all about breastfeeding during cold or flu and taking medications for the same. We'll see you again with another informative video next week.